Hello unique humans, welcome to the very first YouTube video of Chromosome 6. Today marks World Down Syndrome Day, and the first diagnosis of Down syndrome occurred in 1866, and the person who diagnosed it was a physician named John Down, hence how it got its name. And there's a very specific reason why we celebrate it on the 21st of March. Down syndrome is also called trisomy 21 because in this condition is associated with the 21st chromosome having an extra pair. So in a normal human being, there are 23 pairs of chromosomes, but in a patient with Down syndrome, he or she has 23 pairs plus an extra 21st chromosome, making 21st chromosomes. So hence that's why we celebrate this day on the third month, 21st day of the year. 21st day of the third month of the year. So to elaborate on this disease, there are a few physical traits that are common among these patients. One is that they are flat-faced, they have a flat nose bridge, and they have skin lining their inner eyes, which makes their eyes look like an almond, and they have a short neck and short stature. To elaborate more on this, we have a very special guest here with us today, Melisa Edema. She has been a special educator in a leading private school in Sri Lanka for over 5 years now. Hi Melisa.
Hi, thank you for having me.
Oh, it's a pleasure to have you. So how are you doing?
I'm good, excited to be here.
So you came just after school, right?
I did.
So could you paint us a picture of what your day looked like?
I think my attire explains it all. However, starting my day, I guess, before I start my day, I have a lot of prep work to do. So we go to school and it varies. Each day varies. So today was a long day, but nevertheless an exciting one, because in my field you just need to expect the unexpected.
Every day has something new to offer, huh? It's the beauty of having to work with kids, I guess. Yeah. So, how many children do you teach?
Altogether there are 11, and there is 4 of us who teach them. However, we thrive to be an inclusive school, so meaning they won't be in the unit, the education support unit, throughout. They will go to their respective classes for certain periods, and for certain subjects they will be with us.
That's good. But giving room for the interaction also amplifies the stigma. Is there stigma between the students?
Yeah, yes, there is.
So, how do you, are there measures taken to reduce the stigma?
There are. One, like I said, it's an inclusive school, right? So students, they go to their classes, which helps them interact with their friends. And for their friends, they see someone different, they see someone maybe behaving a little differently or looks a little different. However, it helps them to treat them just the way they would treat anyone else. And we also have something called a buddy system.
The buddy system.
A buddy system. So this is when the student comes to us, there is a friend who accompanies her, and when they go back to the classroom, we get the friend to come back to take her back to the class. And if they are playing, just to keep an eye out for these children, and if there's anything that is happening in class that we need to know, they will come and tell us.
That's so nice. I mean, hearing about it is very refreshing, because not being exposed to many of the Down syndrome units, but one thing that comes to mind is the deaf and blind school. So the special needs children are saturated there. They don't have any exposure to what it's like in the normal world. but when they come out of school, they're suddenly exposed to this entire world of people staring at them, and you know. So, do you want to elaborate on that?
Yes, I believe by being an inclusive school, we start small, right? Because children are not taught, they see something and then they follow. So, whatever they see in the society as to how children with special needs are treated, that is how they will treat them. So, by being an inclusive school and also by teaching values like kindness, being kind to someone, caring for someone, looking out for someone, you can break that stigma. You can help not only the child with special needs but also other children who are in the regular curriculum to treat people better when they leave school.
And another implication with Down syndrome kids is that they have a lot of physical ailments, right? 50% of them suffer from cardiac defects, and 30% of them suffer from seizures. So, in that case, educators should be prepared for anything that comes their way. So, do you all have training on first aid and how to handle situations like that?
Yes. So, what I've followed for my um, diploma helped me learn much more about what to do in a situation. And thankfully, I haven't had to face a situation as yet, but it helps to know what to do in case the situation arises, whether it be a seizure or an asthma attack. It helps to know what you need to do, and even if you have to explain it to someone else or a medical professional as to what's going on, you know what you need to say.
That is so true. I didn't think of that.
And thankfully, our parents, they are very transparent with us. And if they think that their child is not fit enough to come to school on a particular day, they will keep them back. But if we see a series of things happening medically, they will keep us informed so that we can always watch out and keep an eye out for these children, even if it's a skin condition, right? Yes, because we live in a country where it's very, very warm. So it helps to know the triggers medically and otherwise.
That's very interesting. There's so much to think about, right? So, another thing that I was wondering was when you talked about parents and how they have to disclose everything. That's not always the case, right? With again, when it comes to the stigma that persists around the topic, parents shy away from telling the entire truth just so they are accepted by society. Have you had instances like that? Has it reduced in the years?
I have faced a couple of scenarios. I guess one of the reasons is all the myths surrounding special needs. So, one of them, as far as I can recall, is if you are a girl, if you see someone who has special needs, chances are that you will conceive a child with special needs. And also, they say if you are pregnant and if you see a child with special needs, your child will become a special child. And they also say children with special needs are born to mothers who have past transgressions, or they live in a village where someone has done something and they need to chase that person off, or maybe someone has cursed the child, right? So all of this plays a role, but also mainly the fact that parents, they have a picture, they have this dream for their children where they want to see them when they grow up. And having a special needs child, I guess the first thing that pops into your head is, what am I going to do? Who is going to help me? What am I going to tell everyone else? Right? I remember a father told me, well, I was in the audience at that time. He said, when my daughter was born, I saw that my daughter was Down syndrome, but my wife didn't know. And in my head, I was thinking, how am I going to break the news to her? Right? So it starts in the close family circle, right? It could either be your closest friends, your relatives. And thereon, parents are a little hesitant to disclose everything about their children, and sometimes that applies to the educators as well, where they don't tell us everything. In the end, we do generally get to know because we tend to connect all the dots, or when we see something is not right, we know where we don't know, which area we have not heard of before. So yes, parents don't generally disclose everything.
Yeah, that reminds me, there was a study which was on the psychological aspect of the mothers or parents of Down syndrome children. And one thing that starts off this psychological burden is that when they get the diagnosis, before the child is even born, physicians are like, you know, always like listing out the disadvantages and no empathy for the mother, no empathy for the family, just, you know, this is what is going to happen, this is going to be bad, all of those things, no regard for whatever the mother is going through, right? And from that moment on, hearing those first few words with your child not yet even born, after it's born, you just look at it as a burden, right? Nothing less, nothing more. It's just a burden that you have to redesign your entire life so that it will suit this burden.
And that pushes parents to fix their child.
Yes.
Say,
Yes.
can you fix my child? Can you make them normal?
Exactly. There's a lot of lack of information. And like you said, how the parents found out only after the child was conceived, right? But there's a lot of tests that are available which you can screen for prior to your, like in the first trimester, even the second trimester of your pregnancy. And details of it will be put up on our blog by the time you see this. So please do check it out. It will be in the description box below. So coming back to the parents and the stigma, there is this no knowledge about the fact that you have to do routine tests, right? It's not just that you get the diagnosis and your child has Down syndrome, but also there's a lot of, like mentioned before, a lot of physical defects that you have to routinely check up on, and like cardiograms and ENT specialists. You need to have routine checkups so that you know that your child is well, because most of them have speech impairment, so they cannot communicate with their parents. We have to find out for ourselves.
So to add on to that, I remember I went to Monaragala once for an assessment, and this grandmother brought this really sweet little boy who was 10 years old. He had Down syndrome. He also had ADHD. He had a heart condition. He couldn't hear from one ear, and he couldn't speak. He was sounding out certain sounds, but he couldn't speak. He was gesturing because he doesn't know sign language. And it was very difficult to keep the boy in place, as you would expect. And then when we spoke to the grandmother, we realized that she doesn't really know much about it. She has not been educated. She's taking care of this little boy because the mother recently had another baby. The father was at work, so he wasn't home much of the time. So yes, you need to educate everyone. As of this year, unfortunately, I do not know. But what I do know is we tried our best to educate that grandmother and tell her these options are available, these are the places that you can go, because financially it can be a burden for some. So yes, we did our best, is all I can say.
So this conversation reminds me of this really interesting study that I thoroughly enjoyed reading, right? It was about 4 Down syndrome adults in the US. They were super independent, they have their own relationships and they have their own jobs, which is very rare to see, right? And one of the major factors that affected their upbringing or their success story was the relationships that they had with their parents. And apart from that, they also, the education system that they were in taught them independence. You can see a lack of that in Sri Lanka, right? So does your curriculum involve teaching independence to students?
Yes. So the students that come to me, they come from the age of 11 and they stay on till their O levels. So the year that their peers would sit for their O levels. And we start from the basics. So we start from using the washroom, basic hygiene, how do I eat without spilling my food everywhere, how do I zip my bag, right? How do I wear my shoes, my socks? How do I make sure that I am clean, not just hygiene wise, but what I wear on the outside, right? How do I wash my hands and not just hold it underneath the tap and come, right? So we start from there and then we go on to making small meals, preparing small meals, right? So whether it be a sandwich or a bowl of cereal, a smoothie or a cup of tea in the morning, right? And then we build it on to something we call functional skills. This is where we teach them shopping, right? Whether they have to go to a supermarket or a store, how do I purchase what I need, because all of us, we have a habit of buying things that we don't need. But what do I need to buy? Then I need to make a checklist to make sure that I cover everything that I need to buy. How can I use a credit card or a debit card to make my payments? How can I book a tuk or a cab to go to a certain destination? How can I give directions to my house? Also, how can I entertain myself? How can I keep myself entertained to make sure that I'm not bored, right? So whether it be watching a movie or doing some gardening or cleaning the house, basic house chores, right? Or if I need a snack to eat while I'm watching a movie, how do I make a bowl of popcorn, right? So all of these things are being taught to them to make sure that they are independent once they leave school. Because something that I always tell parents is that you won't be there every day. Even if they have siblings, they won't be there every day. They will have their own families that they need to take care of. So you need to make sure that these children, they can stand on their own 2 feet. Also, adding on to functional skills, something that I teach is stranger danger, right? So this is something that we teach little ones. Don't take treats from strangers that you don't know. Don't get into their vehicles, right? So we need to explicitly tell it to these children, right? Don't talk to strangers. If a stranger talks to you, don't disclose any of your information. Also, good touch, bad touch.
Yes, that's very important because children with defects like speech impairment are not particularly Down syndrome kids. They have a greater risk of 50%, 30 to 50% risk of being prone to child abuse. So it's so good that you all teach those things.
Yes, because I mean, these children, Down syndrome children especially, you'll realize that they're very affectionate, right? And they will go talk to the most random person you could find, right? But there are people, unfortunately, there are people in this society who misuse that. So we teach them that even if it's a relative of yours, they are not allowed to touch you. They are not allowed to help you in certain instances. If you need to go to the washroom and you need help, then you need to ask your mom to come and help you. And if your mother is not there, then you need to ask someone who is approved by your mother. Even if it's a cousin, even if it's an aunt, right? So we need to go into all of these details and we need to instill in them repeatedly. If something happens, what do? You call someone in your safety net. Could be your mom, your dad, or your sister, or your brother, right? So for that, I need to know how to use a phone. To use a phone, I need to know their numbers. You don't necessarily need to memorize them as long as you have it in your speed dial, right? So all of these intricate things that we don't think of, we need to teach them.
It helps uplift their quality of life. So you were talking about the Sri Lankan curriculum, right? It's not the Sri Lankan curriculum. I think you all have adapted it because there is no independence. Like there is no, not independence, but they don't teach this. Teach independence in the Sri Lankan curriculum.
Yes, and also, so we have something called an IEP, which is an individualized education plan that we make for each child. So depending on their strengths, their limitations, and also if they are following the local curriculum. There are special needs children, even children with Down syndrome, that follow the local curriculum, that sit for O levels, right? And there are some that sit for A levels. Just because they have Down syndrome doesn't mean that they can't do these things, right? So depending on what they wish to do, or more specifically what their parents see them doing, we create this thing called an IEP. In this IEP, we will have certain subjects that we will cover, right? And we will also tell what accommodations that we are willing to give, right? So if they are sitting for a paper, if it's read to them, if it's written by someone else, if they get extra time to sit for this paper, right? And we have life skills and functional skills adding on to it. So all of this depends on a child's strength, their limitations, expectations. We take everything into account.
So does this depend on how long they've been in the program? You said that they come from age 6 to
Grade 6, so age 11.
age 11.
Yes.
To
15, 16, yes.
So what if someone joins when they're 10 or 12? Does that mean that they cannot reach these expectations?
Not really. See, educators, clinical clinicians, educational psychologists, speech therapists, occupational therapists, all of them will conduct certain assessments to see where this child stands. And thereon we will, as a team, get together and discuss what we need to do, right? And where do we draw the line? Where do we start, right? So taking everything into account, it's never too late.
Does it clash with the parents' expectations? I bet there are people, like you were talking about how some parents come and say, fix me, fix my child. So are there parents with like too much of an expectation? So how do you
Yes. So first off, if they decide that they want their child to sit for the local exams, or whether it be Edexcel or Cambridge, we try to support them as much as we can. But if we see that there is no point, right, we give alternatives where we will introduce a vocational curriculum curated just for that child. So we will look at her or his strengths and interests, because you need to do something that makes you happy, right? So we look at all of that, and we have an additional vocational component ready as well. If parents do decide, no, I don't want to follow this vocational path, I only want my daughter to do her O-levels, then there is a chance, if we can't help, we will say, okay, we will provide the necessary accommodations during their assessment. However, the teaching part of it, will need to be done privately. But as for those who do decide to follow the vocational component, whatever we do in school needs to be done at home, right? Because it's team effort. It's educators, clinicians, everyone plus parents, right? So we are bringing up this child together. So yes, we do have conflicts. I wouldn't say no, but so far it has worked out well for me. So yes, I'm happy about that.
Not jinxing it. So you were talking of the Sri Lankan curriculum. Do you see the curriculums abroad and wish they were present in Sri Lanka? Any aspect of it?
I do, because one thing is that educators abroad, not just special needs educators, but all educators abroad are educated on this topic, right? So they know if I have a special needs child in my class, I need to collaborate with the special needs educator, and I need to make sure I do what is necessary. And the individualized educational plan applies to the local curriculum educators as well, right? So as of a whole, educators abroad are much more informed than educators in Sri Lanka. And also they have much better facilities, and they have a lot of avenues, a lot of employment opportunities that Sri Lanka is lacking at the moment. I'm not saying that we don't have, because we see certain companies that employ people or adults with special needs, which is great, right? But then again, wouldn't it be great to have a person with special needs employed somewhere who is working to their maximum capacity because it is their strength and they are skilled in that job, right? So yes, there are certain things that we do need to work on, but technology is vast, right? So it's easy to adapt whatever that is abroad, like how we do with our curriculums, but there is a long way to go.
Yeah, that reminds me, music therapy, it's not very popular in Sri Lanka, but I feel like it would do so much for Down syndrome kids, because there was a study which assessed the rhythmic perception between Down syndrome children and normal children, and both of them had the same level of perception, right? So incorporating music and rhythm into, especially people with speech impairment, would do so much for them.
I remember for one of my assignments, or actually for one of my visits, I went to this place in Rajagiri, I forget the name, where they do music and dance therapy, right? The person who taught me was an adult with Down syndrome.
Oh, that's amazing.
So it is there in Sri Lanka. Music therapy is there in Sri Lanka, just like art therapy is there. It's just that it's not common, and many aren't aware of it.
And not just rhythmic perception, right? Down syndrome children in general have a higher aesthetic, higher talent for aesthetics. Have you come across?
Yes, yes. Even for the viewers, if you come across someone with Down syndrome, you'll realize that they love to sing, they love to dance, right? So it's because, like you said, they have this certain area, right, that they are really good at. And even the little ones that I've had loves to play the drums, right? Would go and run and go and play the drums, right? And it's not that they can't keep the beat. They can. And they like to play the tambourine, right? And sometimes when they see me playing the piano, they would want to come and play the piano, or they will want me to play the piano so that they can sing, right? So, I mean, yes, they do have that skill and that talent, and most importantly, that interest that we need to develop on.
Yeah. So nice to hear these stories. Maybe I'll come one day and watch you teach everyone and have fun with them. I bet you dance and sing along with them, right?
I do. I don't generally dance, but I do the rest.
So talking about facilities, another thing that I noticed, like you, even in your school, there's 4 teachers and 11 children. That is sort of a handful, right? There are other places with like 20, 40 children with just one educator in charge. Imagining 3, 4 children having their outbursts, their sugar rush moments, and this one teacher having to handle and take care of all of them. It's so hard. So, what do you think she or he would do?
I mean, it is difficult, but something that I would like to say is that you don't become a special educator because you have pity. You become a special educator because you like the challenge, because you want these children to be in a better place. Yes, lack of teachers will affect in a certain way, and I wish there'll be more people who would like to take this on as their career, but don't do it because you think it's nice, because you think it's fancy, because you think it'll give you a better name. Do it because you want others to be in a better place, because you want people to treat your children the way they would treat anyone else. And if you do want to help, but you don't want to become a special educator, we have the MJF Foundation. There is Chitra Lane that has unpaid internships. There is Jinendri Resource Center for Down Syndrome. Then there is one more place that I can't remember.
I know of a place. I think for a brief moment, 2, 3 months, I was able to volunteer at Reach Beyond.
Yes, Reach Beyond. And Hands of Hope. Yes, Hands of Hope. So you can volunteer at these places provided that you call them and speak to them regarding it.
And there's no age restriction, no qualification. You can be a high schooler, can be an undergraduate.
I think you need to be a school leaver if I'm not mistaken. And most
And some places want you to be 18 or old.
yes, yeah. And more than anything, as long as you are happy volunteering and you realize that no matter how much they might pick on your nerves, you are not allowed to let it out on them.
And also, when you come from a place of pity, you don't have the intent to watch them grow. You just sit there in the muddle and not see any improvement in the child. So I think it's very important that you pointed out that you should not look at them with pity, but look at them with an aim, like they have to come to a better position. Yeah.
Right? I remember when I was small, one of my family members, whenever she saw someone that had special needs, she used to get really emotional. And that used to get on my nerves because I used to think, oh, can't you see everything that this person can do? Right? I have this little girl, not so little anymore, with Down syndrome, and she's the sweetest little girl you could meet because she's always smiling, right? So whenever someone sees her, they're like, oh, she's so cute. Whereas in my head, I'm like, but can you see what she can do? Would you call her cute or would you call her wow? I mean, look at what you can do. Because now she showed this interest towards art and crafts and painting, right? And when we asked, her parents, they said, yes, these are the things that she likes, right? So again, team effort. We noticed, we asked them, they also had noticed. So as her vocational component, we decided to work on this skill and this interest that she has. And now she makes key tags, she makes bookmarks, she does a lot of raising projects, right? And we have made her portfolio, which will be ready to give to different businesses that wish to employ the skill that she has, right? So when you see someone with special needs, don't just see their physical limitations. When you decide to volunteer at a place where there are special needs children or adults, look beyond what you see and look at the bigger picture and think, what can they do to make a difference, and what can I do to help them make a difference.
This was such an insightful talk, Melisa, and I'm so thankful for people like you who are inspiring children and uplifting these precious souls. So, unique humans, it's now your turn and my turn to spread this awareness and also change the attitude in people towards these children and adults with Down syndrome, because they are not disabled, they are differently abled. And now more than ever, we need more kindness and more inclusivity in our world, now more than ever, right? And also, if you are interested in volunteering or contributing, or even if you need more information for a loved one, then there are a few links in the bio regarding a few organizations in Sri Lanka. Do check them out. And until next time, stay uniquely human. Bye.